Part 1. See if you can answer these chest tube and flex questions right. Question 1. The nurse is caring for a client with a chest tube. During report handoff, the incoming nurse notes that the fluid in the tube is moving up the tube with inspiration and down the tube with expiration. Which of the following actions is the most appropriate for the nurses in this situation? First, increase the suction because it is too low to be effective. B. Place a chest tube on the bedside table in order to stop the fluid from moving up and down. C. Notify the provider. D. Continue with the report as this is the normal finding. A nurse has just received a report on 4 clients who all have chest tubes in place. Which client is a priority to see first? A. The client whose drainage system is standing on the floor. B. The client with continuous bubbling in the drainage chamber. C. The client with the tightening in the drainage tube. D. The client with the suction pressure set at 20 cm H2O. Question 3. A client has fluid in the pleural space and the nurse is preparing for a chest tube insertion. The nurse knows that the insertion site will be located at which of the following locations? A. Under the ribs through the diaphragm. B. Through the sternum. D. 8th or 9th intercostal space. D. 2nd intercostal space. Question 4. A nurse is orienting a new graduate nurse on a cardiopulmonary nursing unit. Care for a client with a chest tube. Which of the following actions by the new grad nurse requires immediate intervention? A. Placing the drainage system below the level of the chest. B. Clamping the chest tube. C. Tubing the client to the bed. D. Connecting suction tubing to the drainage system. Question 5. A client in the ICU has had a chest tube for 3 days. The nurse assesses the client's respiratory status and chest tube during shift assessment. Which of the following would indicate that the client is ready to have the chest tube removal? Option A. There is a minimal air leak. B. The client has only mild respiratory distress. C. The water seal has fluctuations. D. There is little to no drainage.